Welcome to Dr. A for Animals, the podcast that gives you reliable answers to your questions about animal health and wellness and useful tools to help you help animals, whether in your own home or out in the wild. Together with expert guests, I'll give you information that is based on scientific research and clinical experience. I'm Dr. Charla Ansorge, a small animal and exotics veterinarian, and I'm so happy to share my love of animals with you. Let's get started. Welcome to episode 6. We're discussing navigating end-of-life care for pets today, which is a bit of a sensitive topic. It may be difficult to listen to some of the discussion today, so I do want to make sure that as you're listening, you're prepared that some of this may be difficult to hear. It may bring up some hard emotions, especially if you've recently lost a pet or a person or had grief that you're dealing with. It may kind of bring it to the surface. So do give yourself some space for that and take breaks if you need to, and make sure that if you need to have someone nearby to talk to, that you have someone kind of prepared. It can be hard to talk about this stuff, but it's so important to talk about. And I hope that after listening to this episode today that you'll feel a little bit more prepared for facing this difficult time, whether that is happening right now for you and a pet, or you've recently been through it and you're still struggling with grief, or if it's something that you know you're going to have to face at some point, because unfortunately for us, most of our beloved pets don't have as long a lifespan as we do, and we most commonly are faced with having to say goodbye. And it never gets any easier. I've been saying goodbye to beloved animals since I was a little kid, and boy, it was horrible as a little kid, but it's still awful as an adult. But there are things that we can do to prepare ourselves and be ready. And there are things that you may not be aware of, especially if you haven't had to go through a euthanasia with a pet. We're going to talk a fair bit about what that is like and how to be prepared for that, and how to make sure that we can make the death experience as peaceful and comfortable as possible for our little loved ones. So let's get started with this hard discussion. It's so important because so many of us consider our pets family. That is common now. Most of us consider our pets family, which I think is a wonderful thing. I've always felt that way about my animals. Making those decisions at the end of life is one of the hardest parts of having animals in our lives. They bring us so much joy. We have such positive emotions surrounding our pets, and so having to see them going through an illness or a life-threatening injury, and having especially to make the decision to end their life with euthanasia is so difficult. Most of us are just not wired to do that. So being faced with that decision brings up a whole host of difficult feelings. So we're going to start off with looking at being in an emergency situation, because it's a little bit of a shorter discussion. And then we're going to go on to talking about managing pets that have a chronic or terminal illness, talking about hospice care and management of our animals over months sometimes before it's time to let them go. And then we're going to talk about euthanasia itself and coping with grief and loss. So let's start off with emergency situations. When we have an animal with a sudden onset of illness that is life-threatening, so this can be anything from respiratory distress, heart failure, sudden collapse for no apparent reason, which may be because of something like heart failure, a urinary tract obstruction. This is most common in male cats, but also we see it in guinea pigs, rabbits. We can see it in any animal, but it is certainly most common in younger male cats. And it can be also a sudden worsening of a chronic illness. So we maybe have an animal that has had cancer or something like that and has been compensating and doing okay. And then quite suddenly they're not doing well. And then we're faced with, potentially in the emergency room, potentially with a veterinary team that you don't know, who doesn't know your pet, and you're faced with having to make an almost snap decision. Not a snap decision, but a very quick decision because you have a patient who's suddenly suffering. And often, unfortunately, finances can be part of the equation here. So if you have an animal who's been hit by a car and needs major hospitalization and surgery, you have an animal who's thrown a blood clot and is going to need, many days in the hospital, or a cat that has had a urinary tract obstruction generally needs an immediate procedure to relieve that obstruction and then several days in the hospital. And this can mean thousands of dollars. And if you're not prepared and all of a sudden you have this emergency where you have a pet with a life-threatening situation, getting them through it is going to cost you thousands of dollars, and you can't afford that. You may be having to make an end-of-life decision based on finances, which feels terrible, but it does happen, and it happens very often, sadly, because medical expenses are so high. And unfortunately, the veterinary industry is not immune to the cost, and all of the costs that our hospitals have to maintain in order to run mean that charges to our clients, unfortunately, can be really high, especially in an emergency situation with intensive care involved. So things to think about in that kind of situation. You've gotten into the vet, you have an animal that's in pain or not able to breathe well, and you have this horrible, difficult discussion that you need to have, and you need to think. Talk to the vet right away about getting pain control, oxygen, whatever your pet needs to keep them as comfortable as possible so that you have a little bit of room to have the discussion. Because if you're sitting there with an animal that is struggling horribly and nothing is being done to help them, there's no way you're going to be able to think straight and get through this decision and feel even remotely okay about it while your beloved animal is sitting there struggling. So ask the vet, do you think they're painful? If they're painful, let's get some pain medication on board so we can talk about this. And that may mean you need to pay $50 or $60 for an injection of pain medication, or you're going to need to pay $100 to have them on oxygen, something like that. But that is worth it. That it is an expense, but that will be worth it, and you will feel better that you did that. So that animal needs that so that you can take some time to be able to have the discussion with your family, with the doctor, to figure out what you're going to be able to do. The veterinary team should be able to give you a cost estimate, and the doctor should be able to give you some kind of a prognosis, although if it's not clear what's happening with the animal, that can be difficult. If we have an animal that has collapsed or something like that, and we don't know the reason yet, we don't know if they have a big tumor on the spleen that is hemorrhaging internally, or if they're in heart failure, or if they have neurologic disease, it can be difficult to know what the prognosis is if we don't have a clear understanding of what's happening. Now, if we have a cat with a urinary tract obstruction or an animal that has thrown a thromboembolism and has sort of classic symptoms of that, we know what's happening and we have a decent idea of what the prognosis is. And in that kind of situation, I would say if finances are a problem, if the cost is going to be way out of the range of what you can afford and your pet has a poor prognosis for recovery, it's probably best to avoid trying to be heroic. This is certainly a personal choice that's going to be different for every individual and every family. And that choice is ultimately going to be up to you. But if you have an animal that's in a situation that doesn't have a good chance of getting better, then spending thousands of dollars to try being heroic probably isn't the best thing for the pet or for you. Because then you're going to be stuck with a huge bill for a pet that probably is going to end up not making it. If on the flip side of that, you have a pet that has a condition that is immediately life-threatening, and horribly painful or horribly uncomfortable, but has a good prognosis to be fixed. So that cat with the urinary tract obstruction, I keep going to that because it's such a common presentation. That is costly to fix. It's usually a few $1,000s, depending on how badly affected, how long it's been that the cat has been affected. But it's super fixable, and most cats can get through that and be completely fine and live a normal lifespan. That's a different situation. In a case like that, if you can possibly manage it, you want to try, right? You have maybe a 3-year-old healthy cat that's just having this bad situation that can definitely be fixed. In 99% of the time, can definitely be fixed. The cost is still something that a lot of people can't manage. So make sure that you talk to the veterinary team about what you might be able to do to mitigate costs, how you might be able to get quick assistance, because there are a lot of groups out there that will give financial assistance in an emergency situation, or there are these other ways to manage emergency medical care, like Care Credit, which is a third-party line of credit for medical care. A lot of people use it for their own health care as well. And that can be, if you have a decent credit rating, unfortunately, you do have to have that, but that can be you can apply for that and get it approved like within 10 or 15 minutes usually. So that's one option that can help a lot of people. Most hospitals don't have payment plans anymore, unfortunately, so that usually is not going to be an option. But some hospitals do have what they'll call like an angel fund or something like that, where they can give you a discount basically, and the hospital fund will cover part of the care. Most hospitals are not going to be able to do a lot of that because our funds for that are limited, but they may have something like that. You may also be surprised at how much friends and family will be willing to chip in and help you. I have had a few clients do like a GoFundMe page or something, get it on there quickly, put it on your Facebook page, text everybody that you know. And, you get 20 or 30 people chipping in, even 10 or 20 bucks a piece, and you may be able to cover that hospital bill pretty quickly, or at least enough of a chunk of it that it makes it doable for you. So if finances are the major part of the problem, give yourself a little bit of time to come up with some options. If your pet actually has a good prognosis of getting better, we don't want to be faced with having to make an end-of-life decision for an animal that could be fine because of money. And that happens all too often, and it's just an awful situation to be in. So do talk to the team about what you might be able to do to cover costs in order to get that animal better. And in some cases, there may be an animal rescue nearby that would take the pet. This would mean that you would have to relinquish them, and you probably would not be eligible to readopt them. Most places won't let you do that if you have to relinquish them in the emergency room. But it's an option for your animal to go on and live a happy life, and they will find a new family. I worked at a shelter that took on a lot of those cases, so I know that it happens because about 80% of our cases were pets that were relinquished in the emergency room. And it's such a hard thing to have to do, but if you have an option to be able to save your pet's life, even if it means that you have to let them go, it's probably still better for the pet. So a lot of people aren't aware of these options, and that's why I'm bringing them up, so that you know that there are some options there if you have a situation like this. The more that you know going in, the better you can be prepared. Now, if the cost isn't the issue, you have a pet with a poor prognosis or a pet that is actively dying, the best, most compassionate thing we can do for the most part in those cases is to ease their passing, make it as quick and as comfortable as possible with humane euthanasia. And we'll talk more about that, of course. So hard to have to make that decision in an emergency. I've had to do it myself with my own pet, being both the doctor and the mom. Not an easy position to be in. So I totally understand how hard it is to make that decision quickly. So again, ask for that pain medication, maybe a little bit of sedation if needed, so that you can take a little bit of time to make sure that you are making the decision that you need to make. And of course, do whatever you can to be prepared in advance. If you have pets, make sure that you have a basic emergency plan. You know where the nearest 24-hour hospital is. You know how to get there, and you have some idea in mind of what you could afford in an emergency, and possibly, even look into what organizations around you or, accessible via internet, offer some kind of financial assistance in an emergency. Or if you have friends or family that say, hey, you can contact me if there's any kind of an emergency with this pet. They're so important to our lives and our families, and often to our friends. So don't discount what your friends might be willing to help you with. So preparing in advance can make a situation like this quite a lot less stressful, although it's going to be stressful no matter what. If you can discuss, what if scenarios with your veterinary team ahead of time when you're at a wellness visit and that sort of thing, if you think of it, to kind of go over, what would this hospital do if I came in during an emergency with a life-threatening situation? How would that be handled? Just planning in advance as much as you can will help to make this kind of situation a little bit more manageable. But if your pet is in a life-threatening situation and the only real option is to ease their passing, then you may be facing having to decide on humane euthanasia very quickly. So be aware, be ready for the possibility that can happen, and understand that you may have difficult emotions in the moment and afterwards, because often we'll feel like we didn't do enough. We had to make that decision too quickly. We didn't really get to say goodbye. And those are all really tough things to struggle with. They are very natural and very normal. And we'll talk a bit more about that towards the end of this episode today. So that's kind of the quick and dirty about being in an emergency situation. I do want to talk a lot more about our animals that are suffering from chronic illness, terminal illness, where we're managing their situation for quite a long time, because that quality of life monitoring can be really tough. So let's move on to talking about this kind of thing. So this is your animals that have a diagnosis of a terminal illness like cancer, where you may have gone through, you may have decided to go through treatments like chemotherapy, radiation, that sort of thing. And those treatments may fail to cure your pet, which, unfortunately with cancer for people and animals, it's often the case that we do all of the things. We do surgery, we do radiation, we do chemotherapy, and the cancer still wins. And it sucks. But it certainly happens a lot with our animal friends. We also may have a diagnosis of a cancer that is aggressive or doesn't have a lot of options for treatment. And so we're not doing any type of curative treatment. We're doing comfort care, and we'll talk a little more about what that means. This also can be animals that have just a chronic illness that's progressive. So kidney disease, heart disease, neurologic or neuromuscular diseases, and even just arthritis. For a lot of animals, their arthritis and their loss of mobility can become so severe where they have so much chronic pain that we can't manage it anymore in a way that they're comfortable. And so sometimes we are having to make a decision to end their lives because we just can't keep them comfortable. Especially, this is often the case with larger animals that we can't pick up and carry, and have them just snuggle in our lap all day. We have a little bit more time with smaller animals that we can, maneuver. We can do the moving around for them and still keep them engaged in life, versus a larger animal that has loss of mobility. I mean, if you have a horse that can't be mobile, you don't have a lot of time, unfortunately, to be able to work with them. If you have a large dog with really impaired mobility and pain, you have a little bit of time, but still not nearly as much as if you have a little itty bitty dog or, maybe a bird or another small animal that you can carry around. So these diseases can progress a little bit differently in animals compared to people, partly because if you're a human with kidney disease and you need to go in twice a week for dialysis, you can work that. If you're a cat with kidney disease, you're probably not going to go in twice a week for dialysis. It's incredibly expensive. It's difficult to do in animals. Sometimes the type of care that we can do in people just isn't feasible in an animal who doesn't understand why you're doing it. They haven't agreed to do it. They don't want to do it. They're not going to comply. And they may need anesthesia in order to complete some of these kinds of treatment. So some of the radiation therapy for cancer requires the animal being under anesthesia daily, like 5 days a week for 3 or 4 weeks in a row in order to treat. And sometimes that type of treatment just isn't a great option in an animal compared to in a person. And it's similar with some of the arthritis or neuromuscular diseases where some of the support that we would have for a human being able to get around, some of the caretakers and that sort of thing that would be involved, we just don't have the option to do with our pets. So in some cases, we're just limited by what's available or what's feasible for an animal that we can't speak English with or whatever language we speak. We can't speak in the same language. We can't explain to them what's happening and what their choices are. We have to make the choices for them.
Now, that's not to say that some of these more advanced treatments that might be somewhat intensive or time-consuming aren't a great option for certain animals. It varies a lot by what the treatment is and who the animal is and what their personality is like. And of course, your financial capabilities and all that kind of stuff, it all figures into making these decisions. I don't want to sound like I'm against radiation or chemotherapy or any of those other, or even dialysis in certain cases. These things can be life-saving. So it just all depends on that individual's situation and assessing how they're going to respond to that type of treatment and how you're going to be able to manage them during that period of time.
So quality of life monitoring becomes incredibly important in situations where we have a terminal diagnosis or a chronic illness that's progressing. So learning to monitor quality of life and look for signs that your pet is uncomfortable or is declining is incredibly important. So ask your doctor for guidance on how to balance treatment and comfort because in some of these cases where if we are considering aggressive treatment, in some cases animals will tolerate aggressive treatment very well for some period of time, as long as they can be managed in a comfortable and low stress way. And in some cases, the treatment is going to be so stressful and difficult for the animal that it's just probably not the best idea for the animal. Now, sometimes I find clients have an idea of a treatment being super aggressive and difficult for the patient, where I know from experience of doing this with patients that it's actually not that bad. So do talk to your doctor about it. What is this going to be like for my pet? If we go and do, we're going to do this surgery, or, maybe we have a dog with a bone tumor and the recommendation is to amputate the leg. How's the dog going to handle that? Well, most dogs and cats and even bunnies, especially animals with 4 legs, tend to tolerate limb amputation incredibly well, way better than we humans expect. Because when we're faced with the idea of losing a limb, that's very traumatic for us. And there is a lot of psychological and emotional distress associated with that, which our animals probably have some. They're probably a bit freaked out to wake up from anesthesia without a limb. But if that limb especially has been causing them a lot of pain and they haven't been able to use it normally already, they probably feel mostly relief that pain is gone and they're not dragging around this non-functional or minimally functional painful leg anymore. So it is really important to talk with your medical team about what that treatment looks like in reality for most animals, and how stressful it's going to be, and what the recovery is going to look like, and how you're going to be able to manage them at home. So have a good solid conversation about that. And if you have a pet with a relatively poor prognosis for long-term life, make sure that you have a good open conversation about how to monitor their quality of life, and what sorts of regular vet checkups they might need. What would be the importance of ongoing diagnostics monitoring, like blood work and that sort of thing, given the situation for that particular pet. So it does happen relatively often in animals when we do have a diagnosis of a life-threatening condition, that we may have options for treatment. But if that treatment is going to be so difficult or so stressful for the pet, and potentially isn't going to give them a much longer period of disease-free or symptom-free life, that we opt not to do the treatment. And that is fine. If you have a treatment option that has a really good likelihood of providing significant improvement in quality of life for a significantly long period of time, I certainly would want to pursue that treatment if at all possible for that pet. But if we're looking at, well, we have a pet with cancer and we have these options for chemotherapy and this sort of thing, but it's likely that they're going to have significant side effects from this particular chemotherapy, and the likelihood that we're going to extend their life with a good quality for a long period of time is not super great. Well, maybe we don't want to put them through that treatment and put ourselves through the significant financial burden of that treatment. And that is okay, and especially in a case where we just don't have that great of a prognosis or a likelihood of cure. And so then we're looking at palliative care or hospice care. Now, in humans, palliative care and hospice care are specific terms that have a lot to do with the types of treatments that you are eligible for, and the care that you can get at home that's covered by your insurance or Medicare and that sort of thing. So that's a little bit different in animals because we don't have those considerations. So in humans, hospice care is comfort-focused care for people who are within 6 months of end of life, based on their medical team's best educated guess at their prognosis. So most people are entering hospice care very close to end of life. Where palliative care means, and with hospice care, you are not eligible for potential curative treatments. So if you had cancer, you would not be getting any more chemotherapy or radiation or surgery if you were entering hospice care. Where palliative care is managing symptoms in order to provide comfort, even if it means the disease is still present, we're still managing it with whatever options we have. And if you're receiving palliative care and some new cutting edge treatment comes along, you're definitely eligible to have that treatment. In animals, palliative care and hospice care are kind of the same. It means that we have a disease that we are unlikely to be able to cure, and we're not really shooting for a cure, but we are providing treatment to keep the animal comfortable for as long as possible. And so that may mean, an animal with kidney failure is receiving anti-nausea medication and maybe subcutaneous fluid therapy at home, where you're poking a needle under the skin and giving them fluids, maybe daily or every couple of days to help keep them hydrated and keep them feeling better. For patients with cancer, you may have them on pain relief, and also, often there's anti-nausea medication, appetite stimulants, that sort of thing. You're providing certain kinds of nutrition in some cases. You may be having to tube feed in some cases, which that's one of those things that people often will balk at, but it can be incredibly helpful for an animal that just doesn't have a good appetite and is losing a lot of weight, but otherwise could be doing well for quite a long time. There are these types of treatments that we can provide for animals to get them through this period of the end of life in a comfortable and peaceful way. So when you are facing a chronic progressive disease like this, do make sure that we're not just watching the animal kind of slowly decline and wither away. I see this happen a lot, and it breaks my heart. I see animals come in that haven't been in to see me for months or even years, and they have been declining at home, and their family's been watching them decline at home and kind of waiting for them to go on their own. And that's not the kindest thing to do. We know from discussions with humans who can speak our same language that dying is not comfortable, depending on what the disease process is. I mean, certainly if you're doing great and you feel fine and you have a very sudden heart attack while you're sleeping and die in your sleep, I mean, wouldn't we all love to go that way when we're 105? But that's not usually the way that it happens, unfortunately. So the process of dying, depending on the disease itself, can take a long period of time. And during that time, we can have an animal that's very uncomfortable, that may be experiencing pain, poor appetite, lethargy, fatigue, nausea, headaches, all this kind of stuff that we know that people go through, and they may be confused and not understand why. They don't know that they have any options. They just know that they don't feel good. And what it may look like to people is that they're sleeping a lot and they're getting skinnier and they're not eating very much, but that may mean that they really feel awful. So it's important to be monitoring how your pets are doing. And if you think that there's something wrong, bring them in to the vet and try to get a diagnosis if possible. We don't always manage to get a definitive diagnosis, but come up with a plan for hospice care, so that we're covering for, mobility support in whatever way we can, adjustments to the home environment to make it easy for the pet to navigate, providing the right kind of nutrition and support, whether that's using an appetite stimulant or doing a little bit of hand feeding or changing the type of food or the formulation of the food that we're giving. Make sure that we're providing adequate pain control, because there are lots of options for all these things out there. Your veterinarian, the veterinary technicians and assistants, sometimes mobile practices or hospice services all can help you to keep your beloved pet as comfortable as possible during this end of life period. There are some quality of life monitoring sort of checklists that are available, and I'll put a link to one of those in the show notes so that you can have access to that and know what it looks like. And what these do is just help you to identify some specific indicators of comfort and quality of life that you can keep an eye on, and you can kind of re-look at this checklist like once a week and just try to make sure that you're watching for these indicators that things are starting to slip. And if you have a family that's all taking part in the care of this animal, it's really important to communicate to everyone in the family, including kids, that you're watching for these things, that you have a pet who is probably nearing the end of their life, is dealing with some discomfort and illness, and that we need to communicate and all be monitoring closely and kind of trying to think from the pet's point of view and not entirely from our own point of view and our own needs, which, our own needs are, we want to keep this wonderful creature in our lives for as long as possible. And sometimes that's at odds with what the animal needs the most, which sometimes is for us to be able to let go, unfortunately. In some cases, monitoring quality of life might be easier to do with like a journal where you're writing down some basic stuff, the checklist that I mentioned. You could use a calendar where you're kind of tracking good and bad days. One way to think of a quality of life scale is this scale, which is It's HHHHHMM. So it's hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad. So it's a funny little mnemonic, but it is all really important stuff to think about. And that can just help you. That more good days than bad in particular is a really important one, because we can certainly have a pet who will kind of go up and down for a few months, where they feel a little crummy for a couple of days, and they may need more medical support during those days, where you may need to have some medication on hand that you can give as needed to treat whatever the symptoms are that they seem to be having. But it's important to know, just because they're having a bad day or two, that doesn't necessarily mean, okay, this is it, this is the end. We often will have pets that kind of take a downturn for a couple of days. We give them a little supportive care, and then they often will feel better. And they may perk up and have several great weeks, and then maybe they have a downturn again. But it's when we're starting to see that they're having more of those rough days versus good days that we're seeing their quality of life slipping. And we need to recognize when that balance tips from living and enjoying life to beginning to suffer. We don't want to wait for them to be suffering. So we need to use these tools to help us make decisions about what's best for the pet. So in monitoring quality of life, some of the things to think about that'll be on these checklists are, how much they're moving around, how much time they're spending sleeping. Are they going into areas of your home to kind of hide where they didn't used to go? Like, are they going, under the bed or in a closet and spending time there away from people? There are certain behaviors to really look for, but then there's also kind of more knowing your pet and thinking about what makes them happiest. What do they love most about life? What do they love to do? And can they still do that, at least to some extent? For a dog that lives to play Frisbee, who now has super severe arthritis and can barely walk, and they can't chase the Frisbee, they can't chase a ball, they can't even really do like tug of war anymore, and they can't do any playtime. That's a big impact on their quality of life, and it is one aspect that you would need to be looking at and considering. Changes in their daily routine, or just their apparent joy, because we see the joy in our animals, in their body language, in their facial expressions, in the behaviors that they're doing. So writing these things down on kind of a regular basis can help you to really track what's going on. And something to kind of put in your mind is, if you imagine a peaceful end for your pet, what does that look like for the pet and for you and for your family? A peaceful end is better than just waiting for a natural end, oftentimes. I know that we all would like for our animals to make the decision for us and to be able to pass peacefully on their own, but unfortunately it doesn't always happen that way. So as I mentioned a little bit ago, we know from being able to talk to other humans who are going through end of life that process can be very painful and uncomfortable. And I experienced this with my own mom, who died from cancer several years ago and had an abdominal cancer that spread all over her abdomen. And she experienced so much more pain and distress than any living creature should have to experience, despite being in hospice care and on good pain medication and all that sort of thing. And we didn't have the option for humane euthanasia at that time. Some states do have that now, which is controversial, but being in a profession where I have access to humane euthanasia on a regular basis, I would say it is a blessing. And how I wish we had had that option for my mom, because she said to me about a month before she died that she was ready to go and she didn't want to go through any more of this. And that was so heartbreaking to not have that option for her when she was ready to go. She didn't want to have to suffer. but she was sort of forced to because we had to wait for her to die naturally. And that's terribly unfair, in my opinion, to have to put anyone through that. So knowing what she was going through from having cancer, what she looked like from the outside was that she was very tired and sleeping a lot. She had no mobility. She was bedridden. She had lost her appetite. I don't think she ate much I don't think she ate at all for the last 3 weeks of her life. She was getting kind of sponge-fed water from her daughters. And she was on, high doses of opioid pain medication to keep her as comfortable as possible. And the last couple of weeks, she couldn't talk at all. She barely opened her eyes at all. She only responded to pain when we tried to move her to take care of her. And that was awful for her. And that is how a lot of animals spend their last weeks or days as well, because we humans often don't realize what they're going through, because from the outside, they just look tired. They're sleeping a lot. They're maybe, hunkering down somewhere and not moving around much. They stop eating. They may be going through quite a lot of suffering if those are the signs that they're showing. So it's really, really important to keep in mind what the animal is going through is probably not a peaceful passing out of this life. So I know that many people have strong feelings about euthanasia and perhaps religious beliefs that affect your thoughts about euthanasia. If it's the case that you are absolutely against humane euthanasia, I highly encourage you to talk about how to keep your pet comfortable with your doctor. Make every effort to make sure that they are covered for possible pain and nausea. Those are the two biggest ones that so many animals are experiencing during those last days and weeks. We need to be addressing these things for them and not just let them fade away on their own without any support from us. So if you absolutely are against euthanasia, please make sure that you're doing everything you possibly can to keep your pet comfortable. And that also is going to mean some nursing care, keeping them clean, moving them so they're not getting pressure sores if they're staying in one position a lot, taking them out to potty if they are still eating and or drinking. You may need to give them fluid therapy, which your medical team can teach you how to do. Make sure that you're covering for all of that stuff. And if you're not sure, if you have beliefs about euthanasia, but you maybe have a little bit of wiggle room, then I encourage you to think about the fact that your pet probably knows nothing about your beliefs and probably doesn't share them for that reason. And so perhaps it's not the best thing to expect them to live by your beliefs when it would be potentially kinder and gentler for your pet to be able to pass quickly and in a planned way that you can make as beautiful and peaceful for them as possible. I know that's hard stuff to talk about. It's hard for me to talk about with clients sometimes because we often have differing ideas about what's better for the pet. And different backgrounds as far as our beliefs about the ethics of euthanasia. But I will say I have a lot of experience with humane euthanasia, and the people that do go through it with their pets are generally so thankful that their pet was able to go in a controlled environment where their family could be with them. They had pain control on board. They weren't scared and they weren't afraid. And the family didn't have to come home to find that their pet had passed while they were away, potentially in some traumatic way, which is so hard. I know some of you have been through this, to come home and find that something happened while you were gone. And that is so much harder than being able to be there with them and know that their passing was peaceful. It's easier on you for the most part, and it's certainly easier on the pet. I know a lot of people struggle with a concern about making the decision too soon.
And I want to say, when you have an animal with a terminal illness, there really is no too soon. When you know that they have something that is going to claim their life sometime in the somewhat near future, if they're starting to experience symptoms, even if they're still in good spirits and somewhat active, if they're starting to have discomfort from their illness and you know that there is no further treatment that you're going to be able to do that's going to fix that. Like, there's not a cure, there's not management that's going to keep them comfortable for another year or two. There may be some management that might keep them comfortable for the next few weeks, maybe a couple of months. You don't actually have to wait. I know that might sound a little weird, but we don't have to wait for them to be suffering, obviously, before we make the decision to let them go peacefully. People do get very hung up on this idea of, what if I make this decision too soon? You're not going to make it too soon. It's probably better to let them go a little bit sooner when they still are enjoying life some, rather than waiting until you know for certain that they're suffering, because by that point, we may have waited too long. And that is the thing that happens more than going too soon. Waiting too long is relatively common because we are not wired to make this decision. It's very difficult. It's very painful for us. So it's often that we wait a little bit too long. Now, as long as we're maintaining comfort as much as we can, it's probably okay. It's not ideal, but it's probably okay. But that's where preparing in advance and talking to your doctors about how to monitor quality of life is so important for helping you to know when to make the decision. Oftentimes people will struggle with feelings of guilt when they're trying to decide on euthanasia, versus feeling selfish for putting it off. So it's kind of a lose-lose situation for us. We're stuck with feeling like we're doing something terribly wrong when we decide on humane euthanasia, but then we feel like we're being selfish if we decide we're not ready for it yet, because we know that our pet is sick, but we are not ready to say goodbye. These feelings are totally natural, and most people experience some degree of some of that from one side or the other, or both. It's totally normal, and it can take some back and forth with yourself, with your family, with your best friend, before you figure out how to make that decision. So once we have come to the decision that it is time for humane euthanasia for a pet, I want to talk to you a little bit about what that looks like for some of you who either haven't been through it before, or maybe it's been a long time, or maybe you had a not so great experience with it. And unfortunately, that does happen depending on, the medical team that you were with at the time. Some doctors are better at this than others. I think that for the most part, our veterinarians these days are very conscientious about making end of life as peaceful as possible. But I want to talk to you about some things to think about and to make sure that you have in place for your pet when that time comes. Firstly, in most areas, depending on where you live, if you're in a very rural area, you may not have access to this, but a lot of areas do have mobile veterinarians that will do in-home euthanasia. There are some national organizations like Lap of Love, and then there are often local mobile vets who can do in-home euthanasia. So if you have an animal who really hates traveling, or who, it's difficult, travel is difficult, and certainly if you have large animals like, horses and llamas, those kinds of animals, you probably already have a mobile vet, which is helpful. But even for dogs and cats and exotic pets, there are mobile vets out there if you would prefer that. So if you do have a pet that the time is coming, the sooner you can contact one of those mobile vets, the better, because they usually are not available on an urgent basis. So just be prepared. If that's the way that you would like for things to go, you probably need to contact them a few days in advance if you can. That's not always possible. And so,
don't be discouraged if you're not able to get an in-home visit. If you have a pet who doesn't travel well, that you're going to need to bring into the hospital for humane euthanasia, do you also talk to your vet about giving them some sedative at home before you leave the house to make the travel less stressful for them? Because the last thing we want for an animal in their last moments is for them to be stressed out, scared. We don't want them to be going through that for their last moments in the world. We want to make the whole thing as calm and relaxed for them as possible. So get meds on board at home if you need to. Now, if you have a dog who loves being in the car, then make it a fun ride. Maybe even stop at the dog park on the way, and if you can, carry them out, let them sit in the sun. If it's a lovely day, let them enjoy that on the way if they're up for it. Sometimes they're not. Sometimes they're sick enough at the point where we've come to this that they're not maybe going to enjoy that. So let your pet tell you how they're feeling about it, and use the cues that they give you for what they feel like they can tolerate. Now, when you get into the clinic for a euthanasia, you want your doctor to come in and talk to you about what the process is going to be like. Make sure that they talk to you about the potential for sedation first, especially if the pet doesn't have any sedatives on board, and whether or not you want to be present for any of this or all of it. Some people want to be there for the whole procedure. They want to be there at the moment that their pet passes. They want to know that they were holding that paw. And some people aren't comfortable with that, and that is fine. I sometimes have clients who don't feel like they can be there for that last moment, and they feel bad about that. Don't feel bad about that. Try not to feel bad about that. It is okay. For some people, that is just going to be too traumatizing or too upsetting to see, and that's okay. What I encourage those people to do is to stay for the sedation, which is a quick little poke with a needle, and most animals don't even notice that I did it. It's a quick little poke with some drugs that help them relax. They get sleepy very quickly, usually 5 to 10 minutes, and they're just kind of passed out asleep. They're very peaceful. They're not scared. They're not in pain. And that can be the time to say goodbye for some people. If you want to be there for the whole process, what most doctors will do is place an IV catheter so that we have good, solid access to a blood vessel for giving euthanasia drugs, which are given intravenously. I definitely recommend that in most cases we have an IV catheter placed so that we don't have any issue with if the animal is not quite as sedated as we thought. Sometimes the drug hitting the blood vessel might sting and they might jerk the leg. And if we don't have an IV catheter in there, then we just lost access to the vessel, and that can be stressful for everyone. So it definitely is a safer bet to make sure that an IV catheter has been placed. The drugs are given through the IV catheter, and they're very, very quick. So it's important to be ready, to be aware that your pet is probably going to pass very quickly once that drug is given. And they sometimes will do some weird stuff, and that can be upsetting for people. But what I mean by weird stuff is often agonal breathing, which can look like a big, weird gasp that sometimes the animal's face will be sort of contorted and the lips pulled back in a big gasp. And that can happen sort of immediately when the animal is passing, or it can happen several minutes later. And if you're going to be taking your pet home to bury, it's important to know that can happen even like hours later. It's not because the animal is panicking. They're not actually gasping. That's just a physiologic reaction to the loss of oxygen in the system. So it's not, if you see that happen, it's not anything to do with the animal panicking or anything like that. They're not even aware of it happening. So it's important to know what is kind of normal
during the dying process and not a sign that anything is going wrong. And that's one of the most common things that we'll see. You may also see some tremoring. Oftentimes animals will release their bladder, sometimes the bowel, but more often it's the bladder. And in an animal that's been very sick, occasionally they may vomit as well. But again, if these things happen, it's after these heavy drugs have been given, and they are no longer aware of any of that happening. It's happening in the moment, or even just after death has already occurred. The heart has stopped. The brain is not really functioning. This all is very quick, within a few minutes, but some of that, especially the gasp, can happen a fair bit later. So it's really important. This is such unpleasant stuff to talk about and to imagine happening, but it's so important to be aware of what it's going to look like so that you're not hit with something you weren't expecting in your beloved little animal as they're passing. It's important to know once they've gotten some sedation on board, they're out of it. Sometimes they can be roused a bit from the sedation if it's not super heavy. And that's okay when they get the next dose of those IV drugs. And oftentimes, the way that I do it, most of the doctors that I practice with, we also give an anesthetic IV before we give the euthanasia drug, just because we want to know for sure that they're just completely out. That makes it peaceful and easy for them. And it makes it so that you can plan, you can have your family there with you, you can feel comfortable that everything went as smoothly as possible in the last moments of your pet's life. When you go in to the clinic for euthanasia, you also will talk to the staff there about whether you want to do a home burial or a cremation. You can do a group cremation where you won't get ashes back, or you can do a private cremation so that you get the ashes back, and you usually get like a little box, or you can get a biodegradable little box if you want to bury them, bury the ashes, that sort of thing. It is important to think about too, this is a little maybe a little morbid, but if you're going to be burying your pet at home, there often are regulations about how you can do that, like how deep you have to bury them and that sort of thing. So make sure you check into that if that's what you would want to do at home. And also make sure that you're burying them deep enough that a wild animal won't dig them up, because they will have toxins in their body from the euthanasia drugs. So I know that stuff is really hard to think about, but it's good that you're thinking about it. And we especially we Americans tend to have a hard time discussing death and dying. We have a hard time thinking about it and facing the fear and the sadness that we associate with it. But it's important stuff to be aware of, and it's important to know we're all going to go through it. All of our pets are going to go through it. There's nothing we can do about that. We need to face that it's going to happen and do our best to make the most of our living days with our wonderful animal friends, and to make the most out of their lives in whatever way we can. And once they're gone, of course, we will have grief to deal with. So I do want to talk to you a bit about coping with grief and finding support if you need it, which most of us need at least a bit of support going through the loss of a beloved pet. They are usually a very bright spot in our lives, and often for a long period of time, although even animals that we've only known for a short period of time can touch us so deeply. Losing a pet that you've only had for a few months, potentially, is not necessarily any less traumatic or painful than losing a pet that you've had for 20 years. So there's grief. The experience of grief is different for every person, of course. I think we've all heard this, but it's very true. There are certainly stages of grief, but not everyone goes through all of those stages, and not everyone goes through stages in the same order. It's different for everyone. You may feel all kinds of awful, unpleasant emotions, and they can be incredibly intense. So this is a huge part of
dealing with the loss of a pet is dealing with your grief and all of the feelings that go with that during the days and weeks and months and potentially years after you've lost a pet. So let's spend a little time here. Firstly, losing a pet is not a lesser loss than losing a person. People who are not connected to animals may not understand that. So if you have friends and family who don't have strong bonds with animals, they may not get why you're experiencing significant grief. And some people may feel dismissed by friends and family, coworkers. They may not feel like they are taken seriously, that they're experiencing very significant loss and trauma after losing a pet. Just because it's only an animal, and I have that in quotes, only, that doesn't mean that you should just get over it right away and go on with your life. That is just not true. Our connections with animals are incredibly special. They are a huge part of our lives. They are often a massive comfort to us during times when people could not comfort us. And we need to give ourselves room to grieve. And it's important for all of us to recognize that our grief is real and valid and requires time to heal. And people also can go through prolonged grief disorder. So if you find that you're having serious difficulty recovering from grief after the loss of a pet or person or a relationship of any kind, it's important to seek help and get some therapy if you're not having some recovery and some relief from the really intense and difficult feelings of grief. It's normal for those feelings to be intense and difficult early on, but over time they should start to ease up. Now, I mentioned feelings of guilt versus selfishness when we were talking about making the decision to euthanize a pet. And that feeling, especially guilt, can last for a while, and people can get sort of caught up on that feeling like they waited too long, especially feeling horrible guilt if we accidentally caused the death. So, people have accidentally run over their own pet in the driveway. Pets can be harmed by stuff that we have in our homes, whether those are toxins or appliances. So there can be that extra level of guilt and horror and grief if we feel like we had some role to play in causing the death. Some people will feel guilty just for having made the decision to euthanize. They may feel like they gave up on their pet. These are all natural things to feel. These are all things that many, many, many people feel. It's okay to feel it, acknowledge it. If there was an accident, recognize that it was an accident. You didn't intend harm to come to your pet.
If there is something to learn from that experience, that trauma, do your best to learn it, and then allow yourself to forgive yourself. I know it's hard. It feels terrible. But it's very important that we be able to forgive ourselves for mistakes, for accidents, so that we can move on and heal from grief. Lots and lots of people go through this kind of thing. You are not alone if you've experienced something like this or you are experiencing something like this. Another thing that a lot of people struggle with after losing a pet, especially if the pet was also struggling at the end, or if there was some kind of a traumatic ending. Sometimes we've lost pets in the car on the way to ER. It can really stick with you. And often people will replay the traumatizing or upsetting moments over and over again. It's almost like we're afraid that if we let that go, that we're somehow dishonoring what the animal went through, for some people. And it's important for us to let that go and understand that it's not going to dishonor our beloved pet to let the painful memory soften and leave and not continue to dwell on it. It's also really important to stress to yourself that your pet is not stuck in that moment. Keeping your mind stuck in that moment can't change that they went through it, and it doesn't help you heal. Drowning in grief doesn't honor your loved one. It's important to acknowledge the hardship that they experienced, allow yourself to grieve, but then give yourself permission to let it go. It's also really important and helpful to focus on positive memories. There are studies that have shown this for people grieving in various different situations, that the more we think about the positive, happy memories that we have with that lost loved one, the better that we do in our recovery from grief. So do your best to start thinking about all the great stuff that you shared with that wonderful animal as soon as you can. I know for me, I have a ritual of going through all of the photos, every photo from babyhood, if I had them that long, and just looking back at my wonderful animal's life and re-experiencing all of the wonderful, beautiful things that we had together. And that helps to let go of the harder memories that tend to happen toward the end of an animal's life, especially if they've been sick and they've been struggling and that sort of thing. It's hard to let yourself think back to how they were when they were feeling good, but it's so important to do that. It also can be very helpful to do something special to honor a pet's memory. So for many people, some kind of a ritual or ceremony or just a keepsake can help to maintain a connection with that lost pet and memorialize them in some way. A lot of vet hospitals will make a paw print for you, or a birdie footprint, or another small creature footprint. I find those footprints just so wonderful. I have a sort of a little altar to all of my lost creatures and people, where I have photos, and I have their ashes, and I have their little paw prints and a couple of little nose prints and collars, and just having that stuff there just as a sort of memorial and a spot where I can think of them and remember the wonderfulness that they brought to my life. I find that that's very helpful for me. And I know a lot of people that I've talked to also feel better having some sort of a memorial, whether it's an event with other people, or it's just something that you have set up in your home for them, or something that you do. There are lots of different things that you can do to just honor the pet, honor their memory, acknowledge your grief, and give yourself a little help in moving on. There are also some grief support hotlines. There are support groups that are specifically for pet loss. There are some wonderful therapists that can help if you're really struggling with grief. And especially if, it's one of those much harder situations where there's been really serious trauma, or, a pet that you were just really deeply attached to. There are some animals that affect us more than others. We love them all, but some of them just dig their way in so deep, they're that much harder to let go of. So sometimes we need therapy. And that you should get it if you need it, because it really can make a huge difference in your recovery. I'll put a couple of links to some groups that have resources for grief support in the show notes, just to help you find that. And also, if you have kids that are involved, this can be really incredibly difficult for children. Kids experience such intense emotion, and the first time, or even not the first time, but because I'm remembering back to when I was a kid, how awful it was. Losing a pet can be just intensely painful for children. There are some children's books about pet loss that can kind of help them. Whether or not to bring kids along, if you are having a euthanasia performed, that's a personal decision with the family. You have to really think about how you think your particular child would be able to handle that, being present with their pet while they pass. For some little kids, it's really it's too hard for them. And we need to kind of be able to gauge how we think our own kids are going to respond to that. And that can be hard. Everybody has to come to it in their own way. I think for very, very young kids, they just don't understand. And they may actually be kind of a distraction for the older people in the group who are really grieving and struggling with going through the euthanasia. So it can be tough having really little kids present because they may be running around and just, kind of blissfully unaware of what's going on. And kids a little bit older may just have too hard of a time with it, where, young 10, 12, kids or young teenagers may be able to tolerate it a little bit better, and they may have very strong opinions about whether or not they want to be present. So definitely talk to your kids and explain to them ahead of time what's happening. There goes my there goes my feathered kid chirping in. It's very important to make sure that they have some level of understanding before you go in for the appointment, especially if they're going to be coming with you, so that they're kind of prepared for what's going to be happening. And if you have a friend, family member that's struggling with losing a pet or preparing for pet loss, one thing I'll say is the point of listening to them and talking to them about what they're going through is not to try to cheer them up, because they're probably not going to be cheered up. Just be with them, let them know that you're there, and that you can imagine a future for them where they're not constantly just being knocked over by waves of grief. It's important for us to understand that we're not stuck in this emotion. We will get through it at some point. And it definitely helps to have people with us who understand as well. Healing takes time, and it's different for everybody. Everyone's grief is a different experience, and even with each pet, it can be different. And each person that we lose, it's terribly hard. I think it's one of the hardest parts of being alive, is knowing that we all are going to have to go through this kind of thing. But we do have this amazing luxury. I hate to call it a luxury, but it is kind of a luxury of being able to make the passing for our pets as peaceful and pain-free and comfortable as possible via euthanasia. And it's not the right choice for every person, but in most cases, it is the most humane choice for the animal when we know that they are passing, and that there's nothing more that we can do to keep them comfortable. So in a way, we're quite lucky to have that for animals, so that we can plan and we can be prepared, and we can make sure that it is peaceful and a lovely exit from this life. I hope that this has been helpful. This was a tough one. There's a lot for each person to consider when we have a pet who is heading towards the end of life or who has a sudden emergency. And it's just such a difficult situation leading into it, the experience itself, and getting through it afterwards, and adjusting to not having that wonderful creature in your life anymore. But we do get through, we do heal. And we can think about those beautiful pets and the wonderful memories that we have with them. And there will come a time when we can do that with joy again. And then we can be there to give a loving, wonderful home to another animal that needs one. I do hope this was helpful for you. And if you are enjoying the podcast and learning from it, I also hope that you will hit subscribe and join me again in the next couple weeks. I thank you so much for being here and for all of the love that you give to your animals. And Miles the parrot says, go give your critters some hugs and kisses for us. I hope you enjoyed this episode of Dr. A for Animals. This podcast is for educational purposes and does not substitute for specific medical advice for an individual animal or constitute the practice of veterinary medicine. No veterinary client-patient relationship is formed through listening to the podcast. If you have an animal in need of medical care, please see their veterinarian.